Hi everyone, welcome back to Dr. Gaffney's Best Foot YouTube channel. I'm Dr. Gaffney here today to share what has worked for thousands of my patients over the years. In a previous video, we discussed the basics of plantar fasciitis and its initial treatments. Today we're diving into part 2, focusing on chronic plantar fasciitis, or those who've had symptoms for about 3 to 6 months or longer, and solutions that have worked for many of my patients. But before we get started, a quick reminder, the information here is for informational purposes only and does not constitute medical advice. Always consult a medical professional prior to any treatment. This video does not constitute a doctor-patient relationship. Good news, conservative treatment helps in 80 to 90% of patients in plantar fasciitis. Now let's address the issues surrounding chronic heel pain and what you can do about it. If you've been dealing with plantar fasciitis for more than 3 months, despite trying various treatments, it's crucial to consult a podiatrist. Proper diagnosis is key. Ruling out other causes like stress fractures or back-related issues are important. Heel pain can sometimes be referred from back pathology or pinched nerves like spinal stenosis. Make sure you're consulting the right healthcare professional for an accurate diagnosis. That is very important. Now let's talk about the next steps if you've tried preliminary treatments without much relief. So first of all, you have to continue the preliminary treatments that were discussed in my first YouTube video. Those are very important. And it was called Will My Plantar Fasciitis Ever Go Away? Part 1. The cortisone injections can be considered but should be used with caution. As stated previously, they can initially feel like a miracle cure. However, all the previous treatments, i.e. the stretching, the wearing of splints, orthotics, and good shoes must also be continued, or the effects of the cortisone injections will be short-lived. So cortisone injections are typically used for acute pain or acute inflammation. Less useful in chronic conditions. Once plantar fasciitis gets about 3 to 6 months duration, it starts to turn chronic, but you can have acute flare-ups within that chronic condition. So the cortisone injections are helpful for that. If there's still some inflammation or heat in the area, the cortisone injections will help. I tend to be cautious with it because the cortisone can thin out the soft tissue over time and can cause the plantar fascia to rupture, especially if you're doing explosive moves like jumping or running in athletics. So you have to be wary of that. And that is why I only give about 3 within a 6 months to a year duration. And we space out the injections about 4 to 6 weeks apart. If the pain persists after this, it's time to explore other options. So there is rest and or physical therapy. So if rest is crucial, especially if your occupation exacerbates your condition. So your podiatrist can write an order for light duty at work, or you can take a short-term leave to rest your plantar fascia. Cam boots can act like casts. So those are the boots with the Velcro closures, and they go up below the knee, and they have like a rocker sole. So they, the length of the boot acts like a cast, so your body weight goes onto the boot and not on your foot, and that can help your plantar fascia heal over time. So and it also stops that chronic injury reparative process that's damaging the fascia and making it thick and hard to treat. So if I'm resting my patient in a cam boot, I'll typically try to get physical therapy added on at the same time in the form of like non-weight bearing exercises to help with some range of motion and some muscle strength, especially those little muscles in the foot that support the arch, so that if you get those strong, that'll offload the fascia and help it. Also, you can add on modalities like ultrasound and iontophoresis, and that helps the healing process and any inflammation that's in the area. And remember, adherence to the treatment plan is the key to success. So you have to follow the doctor's orders and stay on the path of success. So it's important to continue, like I said, the daily stretching, the use of night splits, the support of the plantar fascia through the orthotics as it's trying to heal, so there aren't any setbacks. But okay, so next step, there is also IASTM treatment. That's ASTYM, and which is a special instrument used for a deep massage that can break up the thick scar tissue from the chronic injury reparative process within the plantar fascia. This is typically done by a trained physical therapist. It is done 3 times a week for 4 to 5 weeks. So you go into the physical therapist's office and they do this for you. It works great. Downsides are, though, include that one, it can be painful during the treatment, but normally feels really good after the session. So you get up off the table and like, ooh, this feels better. And number 2, it can be costly. Co-pays rack up with physical therapy with each session, or there's a lot of out-of-pocket expense with high deductible insurance plans. But at least you're taking a big chunk out of your deductible, and you can meet your deductible more quickly. There's a huge upside with the IASTM. It has 80% success rate if done correctly. I've seen many of my patients avoid surgery with this, so I really love this treatment modality. And there's certain physical therapists that are really good at it that you need to seek out if you want to go that route. The other thing I try to get my patients into is next treatment, custom orthotics. If heel pain persists, custom orthotics may be recommended. While they're costly, they can be highly effective when prescribed and adjusted by a knowledgeable practitioner. That's key. Orthotics are created from an impression of the patient's feet. Orthotics are custom arch support and are used to control the foot motion around a neutral position in order to create an ideal alignment for function and therefore prevent pain and problems. The impression for orthotics taken nowadays is digitally on a computer, but I still like doing it the old-fashioned way with taking the impression with the plaster of Paris, which in my experience gives a better impression and the foot can be manipulated better. But this method takes more time and it takes a longer time to get the orthotics for the patient. The computer generated way, you can get the orthotic back extremely quickly, I think within days. One of the reasons why I like taking the mold with plaster of Paris is the foot can be manipulated while casting, and there's a special technique where you can push the first metatarsal head down, and that helps to decrease the pressure or the tension along the plantar fascia in the orthotic. And this is very important for resolution of the pain. Downside with the custom orthotics is the research has been poor and sparse, leading to the lack of good studies proving their effectiveness over over-the-counter orthotics. So the studies are showing that it's relatively equal, but the methods that were used aren't good, and there's not a whole lot of research on custom orthotics. That's one area that needs to be researched. Therefore, most insurances, they won't cover custom orthotics, and custom orthotics are out-of-pocket expense, and they're expensive, and they run between $300 and $500. So in my opinion, this is tragic because custom orthotics have been vital in alleviating various foot conditions for my patients throughout my career. And other than costs, another downside to custom orthotics is sometimes they are not tolerated in approximately 10% of patients. And unfortunately, this isn't known until you start to wear them. However, if over-the-counter orthotics and arch strapping is tolerated, then it's highly likely the custom orthotics will be tolerated as well. So that we call it low dye strapping. So if that feels pretty good, that usually is a good indicator that you'll tolerate custom orthotics. So custom orthotics adjustment can take up to a month. I recommend that my patients start wearing the orthotics 1 hour the first day, then increase it by an hour every day until you're used to it. Sometimes this is a slow adjustment. Sometimes the adjustment's not necessary, and patients can wear it a few hours the first day without any problems. After the adjustment, which can take up to a month or longer, I recommend that my patients wear them all the time when weight bearing until there is no heel pain at all for 4 weeks. Now at this point, wear them at least 75% of the time to prevent the recurrence of their heel pain. However, whatever problem first causes the plantar fasciitis, such as poor shoe gear, weight gain, and the foot is made stronger with exercise, then one can work with their podiatrist to wean out of the orthotics. This is much easier for young people to do less than 45 years old. As you get older, soft tissue, such as the plantar fascia, gets tighter and tougher and therefore less resilient. In this case, orthotics likely will always be needed to prevent recurrence, unfortunately. One last thing about custom orthotics is that it should always come from one's podiatrist or orthotist with a detailed orthotic prescription from the podiatrist. Mail order custom orthotics are never recommended, and I'm going to get in my soapbox a little bit about this. So the mail order custom orthotics are usually taken with a phone box impression that you get mailed a phone box, you put your foot in it, and you send it off. So you need a knowledgeable, qualified practitioner who can take appropriate impression of your foot in a neutral position in a way that decreases the tension on the plantar fascia. And then you need a practitioner that guides you through the adjustment period, is available for help, that they can help you, and capable to do any modifications. With mail order or store custom orthotics, you can also have this done in the store. One does not have the ability to get orthotics modified, leaving the devices unusable in some cases. Modifications are frequently needed because impressions are taken of the foot at rest. And then, as you walk, problems arise that you didn't know about. Modifications always require an in-person visit with your orthotist or podiatrist. Also, mail order phone box custom orthotics can run over $200, which is a hefty price to pay to have A, no knowledgeable practitioner who writes your prescription based on your exam and problem, and then B, have no follow-up and no one to modify your orthotics when there's problems, and C, your health savings account can't be used to purchase mail order orthotics. Okay, so that's over. Okay, so the next treatment would be platelet-rich plasma, or PRP. You might have heard of this. PRP injections use your own blood and has shown promise in treating chronic plantar fasciitis in some studies. So what they do, they draw your blood and they spin it down in a centrifuge to separate the platelet-rich plasma. PRP has many growth factors which help to heal the plantar fascia. They're showing studies that it can actually reduce the plantar fascia at the insertion site, which is very important. The thick plantar fascia at the insertion site at the heel has been shown to be a big culprit in the failure of treatment of plantar fasciitis, and that's what happens when the condition gets chronic. The plantar fascia gets real thick at the insertion, and it makes it really hard to treat. However, it's an expensive option, running between $500 and $2,500. Availability may be limited. Medicare does not cover PRP injections. And as a general rule, if Medicare doesn't cover something, then the other insurances won't cover it either. Okay, so we're at the end here. So you've had all the treatment and it's working and you're getting pain relief, which will happen if you follow all these treatments. So lastly, when you're pain-free, how do we prevent recurrence? So once pain-free is crucial to prevent recurrence. A lot of times I've had my patients just after they get the cortisone injections, they're feeling pretty good, and they disappear. And then they come back 4 months later saying, oh, it hurts so bad. And it's because they kind of fell off the wagon. They didn't go to the end. So so it's really important to stay with your doctor and like follow through to the end there. So once my patients become pain-free with consistent treatments, which can take a few months, then I recommend at least the use of a custom orthotic about 75% of the time when weight bearing. So that is unless there's favorable conditions to wean from them, as we talked about previously. But many people at this point probably do need to wear the orthotics at least some of the time. So you use the night splint once a week. You do once daily stretching. And I recommend doing these maintenance treatments for about another 6 months. If after 6 months there's still no pain coming back, then you can stop doing these things. Then the patients can stop doing these things. However, stretching daily, I think, is always an important good practice for foot health. At this point, I instruct my patients to be cognizant of any twinges of pain. And if this happens, return to treatment as necessary if it does recur. So get back on your night splint, go back to your orthotics, go back to stretching frequently throughout the day. So that wraps up part 2 of our series of chronic plantar fasciitis. Stick with your practitioner. Just keep doing those treatments. It's going to get better. It just takes longer after you've had it for about 3 to 6 months. So it'll take you several months to get through it all, but keep working with your doctor. It'll get better if you stick to the plan. So if you found this information helpful, give us a thumbs up, and don't forget to subscribe to my channel and my blog at drgaffneybestfoot.com. Stay tuned for part 3, where we'll explore advanced conservative treatments and surgical options. As always, consult your healthcare provider for personalized advice. And thanks for watching. Here's to your best foot forward. We'll see you next time.